And as federal healthcare tax credits are set to expire, Virginia community health centers are warning of a crisis that could leave thousands without access to basic care.
Thousands of veterans who are suffering aren't waiting. Desperate for help, they're attending psychedelic retreats.
They served their country. They wore the uniform, went through hell, took bullets to protect interests beyond their understanding. They came back with invisible scars, nightmares that won't fade, flashbacks that hit in the middle of the night. And when they returned, they found a wall. Cold, silent, bureaucratic. That wall is made of private psychiatric clinics under contract with the U.S. government. Institutions meant to heal veterans, to fix them, to give them a chance at a normal life again. But in reality, they trapped them in an endless loop of neglect, forced treatments, and exploitation. To understand how this happened, we need to look at the money. The Department of Veterans Affairs, or VA, manages healthcare for former service members. In 2024, its budget exceeds $300 billion. That's one of the largest federal budgets outside the military. To put that in perspective, that's more than Finland's entire GDP. Part of it goes directly to public hospitals, state-run facilities. But a massive portion is outsourced. Mental health care, clinics, specialized centers, often managed by private groups. And that's where the system breaks down. Because we're talking about business here, not care. About profitability, not support. About financial growth, not healing. Some groups operate up to 20 clinics across multiple states, with zero medical expertise to start with. Investment funds, businessmen, managers from real estate or finance. Their specialty, billing. Their obsession, bed occupancy rates. And here's how they maximize profits. Every hospitalized veteran is a captive client. Every day spent in a facility equals up to $2,000 billed to the government. Per patient, per day. The longer the stay, the higher the return. It's mathematical, it's predictable, it's optimizable. And how do you extend hospitalization? Just inflate the diagnoses, or add more treatments, or justify enhanced monitoring, or invoke an imminent relapse risk. It's industrial logic. Beds need to turn over, but not too fast. Some patients end up hospitalized for months with no real therapy, no visible progress, just to keep the machine running. Meanwhile, families worry, call, beg for updates. Often, they're told it's confidential. But the financial abuse is just the beginning. The medical abuse is far worse. The testimonies are chilling. Some veterans report receiving up to 20 pills a day, with no clear evaluation, no explanation, no ability to refuse devastating drug cocktails, powerful antipsychotics that turn patients into zombies, addictive benzodiazepines prescribed for months, antidepressants in overdose causing confusion and dizziness. A 29-year-old veteran, former Marine, reported being diagnosed bipolar after a single 15-minute interview. No medical history consulted, no second opinion. He was then placed under sedation for 10 days, unable to get up, unable to speak to his family. In Florida, another patient died from a medication overdose after receiving 4 times the authorized dose of Seroquel. The death was classified as an isolated medical incident. No investigation was opened. The family had to fight for 2 years just to get the medical records. Between 2015 and 2023, over 2,400 suspicious deaths were recorded in private VA contract clinics. Many are declared natural, but several families denounce concealed overdoses, injections without consent, covered-up medical errors, missing files, silent witnesses. And behind every death, every overdose, there's a paper trail leading back to one thing: money. Every action becomes a billing line. Every interaction, a profit opportunity. A 10-minute group therapy. Billed as a full 60-minute session, a quick psychiatric consultation. Billed as an hour-long in-depth evaluation. A simple routine check, coded as complex psychiatric assessment. A medication distribution, transformed into a pharmacological consultation. GAO, Government Accountability Office, audits revealed that some centers billed for care that was never provided. Ghost patients, fictitious treatments, forged signatures on consent forms, therapy hours invented out of thin air. And meanwhile, the leaders of these groups get rich six-figure annual bonuses, stock options, luxury cars, second homes, all on the backs of those who risked their lives, all funded by public money meant to heal the wounds of war. For many veterans, these facilities become something else entirely. Prisons without bars. Some veterans never get out. Others come out broken, worse than when they arrived. Prolonged isolation, deprivation of family contact, forced treatments. Some centers resemble medical prisons. Patients report being held against their will, their discharge requests denied for vague reasons. Instability, relapse, risk, non-cooperative behavior. An internal 2022 report indicates that over 17% of patients hospitalized in private VA clinics stay longer than 90 days, often with no clear medical justification. 3 months, sometimes 6, sometimes a year. The goal is no longer to heal, but to keep the bed occupied, to maintain the payment flow, to maximize return on investment. And when they finally escape this system, there's nothing waiting for them. When they finally get out, veterans are often left to fend for themselves. No follow-up, no reintegration, no outpatient therapy, no support groups, just a prescription, physical and psychological after-effects, and a plastic bag with their belongings. Some develop addictions to the medications they were forced to take for months. Others sink into depression, unable to manage the brutal withdrawal. Many end up on the streets, without resources, without direction. Today, in the United States, over 40,000 veterans are homeless, and a large portion of them went through these clinics. The circle is complete. War broke them. The system meant to heal them threw them away, abandoned a second time. Now here's the part that should make you angry. The government knows all of this. The government knows about this scandal. But it looks the other way. Because opening this Pandora's box means admitting failure. The 2022 GAO report warned of serious failings in the management of private contractors. It recommended surprise inspections, enhanced oversight, financial penalties, but no shutdowns, no sanctions. Contracts were renewed. Business as usual. Why? Because any change would challenge a massive outsourcing system. Because private healthcare lobbies carry heavy weight in political decisions. And no politician wants to be the one to say, "We abandoned our soldiers." The clinics continue. The silence remains. And the deaths pile up. Think about what this means. They were betrayed twice. First on the battlefield, when they were sent to wars they didn't understand. For reasons that changed over the years. For victories that never came. Then upon their return, when they were promised care and given a chemical straitjacket. They never asked for luxury, just dignified treatment. Someone to listen, a bit of humanity, recognition of their sacrifice. Instead, they received rushed diagnoses, sedatives, and closing doors. Cancelled appointments, ignored calls, lost files. This isn't an accident. This isn't a mishap. This isn't a temporary malfunction. It's a cold mechanism, rational, profitable. So let me be clear about what we're dealing with here. Clinics that destroy instead of heal. Contracts that enrich shareholders on the suffering of forgotten heroes. Families mourning deaths no one explains. A system that crushes those it claims to save. That's the reality of the VA system. And as long as no one confronts it, it will continue. Because in this story, these aren't mistakes. It's a business model, a silent empire built on pain. Silent Empire is the voice of those who were silenced, those who gave everything, and from whom everything was taken.